The real cause of stroke might not be what you think. Most of us have heard that high blood pressure and atrial fibrillation are to blame, and that's partly true. But those are just warning signs, not the true source. They're like the tip of an iceberg, with something much more dangerous hiding beneath the surface. A heart surgeon once told me that nearly every patient he operates on has a thick layer of visceral fat wrapped around their heart. That fat didn't appear overnight. It's the result of a deeper problem that also drives high blood pressure and irregular heartbeat. That problem is insulin resistance. When your body becomes resistant to insulin, everything begins to unravel. Blood pressure rises, inflammation takes hold, fat builds up around your organs, your heart becomes more vulnerable, and yet most people have no idea it's happening. That's why this video is so important, because once you understand how insulin resistance works and the subtle ways it shows up in your daily life, you can take real steps to reverse it. In the next few minutes, I'll show you exactly how. Keep watching. This could be the most important health message you hear this year. At the heart of many chronic diseases, especially stroke and heart disease, there's a root cause that often goes unrecognized. Insulin resistance. It's a metabolic dysfunction that begins quietly but leads to serious complications over time. Unlike more dramatic symptoms like chest pain or paralysis, insulin resistance works behind the scenes, disrupting nearly every system in your body without your immediate awareness. So what happens when your cells become resistant to insulin? Insulin is a hormone produced by your pancreas, and one of its main jobs is to help glucose, sugar, enter your cells where it can be used for energy. Think of insulin as a key that unlocks the doors to your cells. But in insulin resistance, those locks start jamming. The keys don't work properly and sugar remains in the bloodstream. To compensate, your body produces even more insulin, flooding your system in an attempt to overcome the resistance. Over time, this creates a toxic internal environment that accelerates inflammation, stores fat in the wrong places, and places continuous pressure on your cardiovascular system. According to the Mayo Clinic, insulin resistance plays a central role in metabolic syndrome, a cluster of conditions that includes high blood pressure, abnormal cholesterol levels, excess body fat around the waist, and high blood sugar. Individually and collectively, these factors significantly increase your risk of stroke, heart disease, and type 2 diabetes. But the damaging effects of insulin resistance go beyond numbers on a lab test. Chronically high insulin levels change how your organs function. They tell your kidneys to retain sodium, increasing blood volume and blood pressure. They inflame the lining of your blood vessels, contributing to arterial stiffness and hardening, atherosclerosis. They also lead to the accumulation of visceral fat, fat stored deep in your abdomen and around your organs, which releases harmful chemicals that further disrupt insulin sensitivity. While lab tests like fasting insulin, HOMA-IR, and lipid panels can diagnose insulin resistance, the truth is you don't always need a blood test to see the warning signs. Your body often gives you clear signals, if you know what to look for. Here are 7 of the most common and most important clues that your body may be fighting insulin resistance. 1. A growing waistline. This is perhaps the clearest sign. A waist measurement over 40 inches for men or 35 inches for women is more than a cosmetic concern. It's an indicator of visceral fat accumulation. Unlike the fat just under your skin, visceral fat surrounds vital organs like the liver, pancreas, and intestines. It behaves like an active endocrine organ, releasing inflammatory molecules that impair insulin signaling and contribute to metabolic dysfunction. According to Harvard Medical School, abdominal obesity is a stronger predictor of cardiovascular disease than BMI alone. 2. You struggle to lose weight, especially belly fat. Many people try to lose weight by eating less and moving more, but still struggle to shed fat, particularly in the midsection. That's because insulin is a powerful fat storage hormone. When it's elevated, your body essentially goes into storage mode. It prioritizes storing energy over burning it. In this state, even a strict diet may yield minimal results. If you're doing everything right but not seeing progress, Persistent insulin resistance may be to blame. 3. Your blood pressure starts to creep up. High blood pressure is often seen as an isolated condition, but for many it's a consequence of insulin resistance. Elevated insulin tells your kidneys to hold on to sodium, which increases water retention and raises blood volume. Additionally, insulin stimulates the sympathetic nervous system, which tightens your arteries and further raises pressure. That's why even borderline readings like 135/85 mmHg should not be ignored, especially if they're trending upward. 4. The appearance of skin tags or dark skin patches. The skin can offer subtle but meaningful insights into your metabolic health. Small, benign skin growths called skin tags often appear in areas like the neck, armpits, or groin. These are frequently associated with high insulin levels. Another telltale sign is acanthosis nigricans, dark, velvety patches of skin, particularly in body folds. According to the American Academy of Dermatology, these skin changes often precede a diagnosis of type 2 diabetes, making them early red flags for insulin resistance. 5. You often feel hungry and can't go long between meals. Do you find yourself needing to snack constantly, or feeling shaky, tired, or irritable, hangry if you miss a meal? These are signs of unstable blood sugar levels, another hallmark of insulin resistance. After a carb-heavy meal, your insulin spikes to bring blood sugar down. But when insulin remains elevated for too long, it drives blood sugar too low. This triggers a stress response and intense cravings for more sugar or carbs. It's a vicious cycle that many people mistake for a lack of willpower, when in fact it's being driven by underlying physiology. 6. Abnormal blood fat numbers on your lab results. Your cholesterol numbers can reveal more than just your risk of heart disease. They can also indicate insulin resistance. One common pattern is high triglycerides combined with low HDL, good cholesterol. This dyslipidemia is frequently seen in people with metabolic syndrome and insulin resistance. Studies from the National Institutes of Health show that this lipid pattern often appears years before overt diabetes, acting as an early warning sign. 7. Feeling tired and sluggish after a meal. It's normal to feel satisfied after a meal, but it's not normal to feel like you need a nap. If you often feel sluggish, foggy, or downright exhausted after eating, especially after meals rich in refined carbs, your insulin levels may be spiking too high. That insulin surge clears sugar from your bloodstream quickly, causing your energy levels to plummet soon after. It's another example of how insulin resistance disrupts normal energy regulation. If you recognize 2 or more of these 7 warning signs in yourself, don't brush them off. Your body isn't just aging, it's sending out a distress signal. What we often label as high blood pressure or atrial fibrillation are not isolated diagnoses that appear out of nowhere. They're not random misfires. They are the body's emergency response, your internal alarm system, after years of silently struggling with elevated insulin. The problem isn't just the rising numbers on a blood pressure monitor. It's what's driving those numbers in the first place. And taking medication without tackling that deeper cause, insulin resistance, is like grabbing a mop to clean up a flooded floor while the sink is still gushing water. You're managing the symptom, not the source. Here's what's really happening. When insulin levels are chronically high, your kidneys are constantly told to hold on to sodium. And where salt goes, water follows. That extra water increases blood volume, placing more and more pressure on the walls of your blood vessels, similar to overinflating a balloon, stretching it closer to the breaking point. Now imagine the arteries themselves. In a healthy person, these vessels are soft, elastic, and responsive. But under the influence of long-term inflammation triggered by high insulin, they become rigid and damaged. Tiny cracks in the vessel lining accumulate plaque. The arteries narrow and harden, forcing the heart to pump harder to push blood through. Blood pressure rises, not as a random malfunction, but as a direct result of chronic metabolic stress. And it doesn't stop there. Elevated insulin also sends your body into a constant state of physiological alertness, speeding up your heart rate and constricting your blood vessels. amplifying the pressure even more. This is one reason why so many people wrongly assume that emotional stress is the root cause of stroke. In truth, it's this deeper biological stress that builds up silently and persistently over time. Perhaps the most dangerous effect of insulin resistance is the growth of visceral fat, especially the kind that encases your heart, known as pericardial fat. This fat isn't just sitting there. It's metabolically active. It releases inflammatory chemicals that directly irritate and inflame your heart muscle. Over time, this creates the perfect storm for atrial fibrillation, an irregular heartbeat that dramatically raises your risk of stroke. So now that you understand what's really fueling these life-threatening conditions, the question becomes, what can you do about it? In just a moment, I'll walk you through 3 powerful, science-backed strategies that people over 50 are using to reverse insulin resistance and take back control of their health. These are not trends or hacks. They're practical, proven actions that target the problem at its root. But before we get into that, if this message is striking a chord with you, if you're starting to see how these pieces fit together, please take a second to subscribe to our channel. This kind of information isn't just useful, it's life-saving. And we want to make sure you never miss the insights that could change your health and possibly even save your life. Now let's explore what you can start doing today to protect your brain, your heart, and your future. Pillar 1. Be mindful of what you eat. One of the most powerful ways to begin healing insulin resistance is also one of the simplest. Stop feeding it. And insulin resistance doesn't happen in a vacuum. It's often the result of years, sometimes decades, of consuming foods that constantly trigger insulin spikes. When those spikes happen daily, the body becomes less and less responsive to insulin signals. Over time, this forces the pancreas to produce more of it, and the cycle deepens. The first place to start is sugar in all its modern disguises. It's not just the obvious culprits like soda, candy, and baked goods. Many foods that seem healthy at first glance, flavored yogurts, boxed fruit juice, granola bars, deliver a sugar load that overwhelms the system. These foods prompt an immediate and dramatic insulin response, setting off the same metabolic chain reaction that leads to fat storage and inflammation. But sugar doesn't act alone. Its close cousins, refined carbohydrates, follow the same path. White bread, pasta, white rice, crackers, and sugary cereals all break down rapidly into glucose once they enter the bloodstream. The body reacts as though you've eaten a spoonful of sugar, even if it came in the form of toast or a bowl of cereal. The insulin response is swift and sharp. But there's one more ingredient that deserves attention, and it's one many people don't even realize is harmful. Industrial seed oils like soybean, corn, and canola oil have become staples in processed foods. While marketed as heart-healthy, these oils are often chemically processed and, when consumed in large quantities, can promote inflammation at a cellular level. That inflammation worsens insulin resistance and puts even more stress on your cardiovascular system. Once you understand what to limit, the next step is knowing what to embrace. This isn't about restriction for the sake of dieting. It's about choosing foods that support insulin sensitivity and stabilize your body from the inside out. The best place to start is with protein, specifically high-quality, whole food sources like fish, eggs, and lean meats. These foods help you feel full longer without triggering insulin surges. They're metabolically quiet but deeply nourishing. Alongside protein, healthy fats deserve a permanent place at the table. After years of fear surrounding fats, science has now confirmed that natural sources of fat, such as those found in avocados, extra virgin olive oil, raw nuts, seeds, and even butter from grass-fed cows, do not harm your metabolism. In fact, they may help regulate it. These fats digest slowly, keep blood sugar stable, and provide long-lasting energy that doesn't send insulin levels soaring. And finally, no plate is complete without vegetables rich in fiber. These are the unsung heroes of blood sugar regulation. They slow down digestion, prevent glucose spikes, and nourish your gut, all of which contribute to better insulin sensitivity. Leafy greens, cruciferous vegetables, and colorful varieties like bell peppers and carrots are excellent choices. Once you begin to shift your plate in this way, less sugar and refined carbs, fewer industrial oils, more whole proteins, fats, and fiber, you begin to rewire your body's hormonal environment. You're no longer feeding insulin resistance, you're starting to fight it. Pillar 2. When you eat. The second pillar builds directly on the first. Once we've changed what we eat, we must consider when we eat. Modern eating patterns have normalized a near constant state of grazing. Breakfast, snacks, lunch, another snack, dinner, and sometimes late-night eating. This means insulin rarely gets a break. Every bite, no matter how small, signals the body to produce insulin. And if insulin is always present, fat storage continues, inflammation lingers, and resistance worsens. To reverse that trend, your body needs periods of rest, time without incoming food so that insulin can fall, and healing can begin. This is where the concept of intermittent fasting becomes valuable. While the name may sound technical, the practice is ancient and intuitive. It simply means limiting the hours in which you eat so that your body can enjoy regular windows of fasting. The most accessible starting point is a 12-hour fast, finishing dinner by 7 p.m. and not eating again until 7 a.m. the next morning. Since you're asleep for most of that time, it doesn't require willpower. It just requires a small adjustment in timing. That fasting window gives your insulin a break. It signals the body to shift out of fat storage mode and start tapping into stored energy. Over time, as you grow comfortable, you might experiment with slightly longer fasting windows, 13, 14, even 16 hours, if they suit your body and lifestyle. The key isn't perfection, but consistency. In parallel, one of the most effective changes you can make is eliminating snacks between meals. Each time you snack, especially on carb-heavy or sweet foods, you stimulate insulin again. By focusing on satisfying meals that include protein, healthy fats, and fiber, you reduce the urge to snack and give your body longer periods of metabolic rest. This balance between nourishment and rest is where your hormones recalibrate. When insulin levels drop and stay low for a few hours, your body begins to burn fat rather than store it. Your hunger normalizes, your cravings fade, and perhaps most importantly, your cells become more sensitive to insulin again. This shift isn't just about eating less, it's about creating space for your body to heal. Pillar 3. How you move. The final pillar ties everything together. Movement isn't just about burning calories, it's about teaching your body how to use sugar more effectively. Skeletal muscle plays a vital role in this process, and it acts like a sponge, absorbing glucose from the bloodstream and storing it for energy. But it can only do this efficiently when it's being used. Regular movement, especially after meals, allows your muscles to actively pull in glucose, helping to prevent post-meal blood sugar spikes and lowering the demand for insulin. One of the simplest yet most effective practices is to take a short walk, just 10 to 15 minutes after your largest meal of the day. You don't need to power walk or jog. A gentle stroll is enough to activate the muscles and direct glucose into the cells. Studies have shown that post-meal walking significantly lowers both glucose and insulin responses, especially after carbohydrate-rich meals. Beyond walking, strength training offers another layer of protection. You don't need to lift heavy weights or join a gym. Bodyweight movements like squats, lunges, wall push-ups, or resistance band exercises done at home can make a meaningful difference. Each time you build or maintain muscle, you increase your body's capacity to store and utilize glucose without needing large amounts of insulin. In this way, muscle becomes your ally in reversing insulin resistance. As you begin moving with purpose, timing your meals with intention, and nourishing your body with the right foods, each piece reinforces the next. These aren't isolated tactics. They're an integrated system working together to support a healthier, more responsive metabolism. And the best part is, none of this requires perfection, just steady, consistent steps in the right direction. When you make these changes, what you eat, when you eat, and how you move, you're not just improving a number on a chart, you're resetting your metabolism. You're tackling insulin resistance at the source, which is one of the most powerful ways to protect yourself from stroke and heart disease. If this video helped you see the bigger picture, don't stop here. Subscribe to Senior Health Guide for more practical, science-backed tips made for adults over 50 who want to stay sharp, strong, and independent. And if you know someone who needs to hear this, share it with them today. Stick with us. Our next video covers the early signs of stroke most people miss.